Thank you for joining the Population Health Innovation Lab, known as PHIL, for our final session in our three-part series, Improving Population Health Through Multi-Sector Collaboration. Today's session is Digging Deep into the Data, a repository of lessons learned about aligning. And you should have received a notice when you joined the event, but just so you're aware that today's event is being recorded, so please be sure that you are muted during the presentation. And know that a copy of the slides and the recording will be available on the PHIL website following the event. So to start us off, I'm going to pass us to the director of PHIL, Sue.
Great. Thanks so much, Becca. Welcome, everyone. We're excited to be with you again today. Hopefully, you've had the chance to participate in all three. This is the third in our three events that we are offering. And today, actually, let me start just to overview. Our first session was held on May 24th, and it focused on the secret sauce. Stephanie Bultema shared what are the top 3 things to do when aligning systems for health. And then last week, we had a panel of 4 representatives from ACH's, 2 in Washington and 2 in California, who shared their very concrete examples about how they implemented that secret sauce. And then today we're going to go on a deeper dive into the data, right? So it's all of the repository, or AKA, I'm calling it the gold mine, because it's pretty amazing. You could totally nerd out on all of this stuff, hopefully. And, we recognize that you could be in a lot of places, and we're just really grateful that you're here with us today. We'd love for you to put in the chat, like the name, your location, and we're just really curious about what drew you here today. What do you hope to learn? Like, aside from funding, are you on a journey seeking something that maybe this could help you with in your work of multi-sector collaborative? So just love to hear from folks. Okay, so our agenda today, we're just going to do a short overview to PHIL. I think Stephanie's going to do a short recap, just so people have the context on parts 1 and 2. And then we're going to review the data walk, this actual live website. So you are here with us today as it's going live. And then we wanted to provide the opportunity for people to either individually, you could go into a breakout room with other folks who might be interested in a topic, or just by yourself, just really exploring, and then come back together really and just hear any questions and dialogue. So our objectives today really are to describe the top 3 things to do when aligning systems for health. Also explain where to find additional resources to learn more about the secret sauce elements, and identify at least 1 new resource you want to dig deep into to learn more about multi-sector collaboratives or aligning systems for health. Okay, next slide. So we just want to take a moment to, I think we're all meeting virtually. We're all coming from different places, and I just want to acknowledge the importance of the land. And the Population Health Innovation Lab respectfully acknowledges that we live and operate on the unceded land of Indigenous people throughout the U.S. And acknowledgement is just the beginning. I think we all are doing work with lots of different communities, and really making sure that you're acknowledging and learning about the land and the people who are from the land and living there is really, really important. And this should be an invitation for all of us to do deeper analysis, relationship, and action. We just invite you to learn a little bit more about going beyond land acknowledgement, and we are putting some resources in the chat there for you. So just lastly, just a little bit about the Population Health Innovation Lab. We are a program of the Public Health Institute, and we are very much, drawn to the success and impact of multi-sector collaboratives, in particular, health-focused multi-sector collaboratives, and kind of going a little bit deeper is accountable communities of and for health. We offer communication support. We do development of multi-sector collaboratives, meeting design, research. You're going to hear about all of the research, technical assistance, as well as training and learning opportunities. So with that, I think I'm going to now turn it over to Stephanie, who's going to kick us off.
Thank you, Sue. All right, so I'm going to start off by just telling a little bit about the research underlying this learning series, which explores how collaboration and alignment among public health, healthcare, and social service sectors in partnership with community residents and tribal nations leads to outcomes in 22 accountable communities of or for health, or ACHs, in Washington and California. And I'm going to build on Sue's recap of where we went the last two times. So in our first part, Secret Sauce for Aligning Sectors, we shared the top 3 things that across our years of research around aligning systems for health, we synthesized everything that we've learned from interviews and focus groups and meeting observations and surveys and document review into these 3 things that we recommend. If you are aligning systems for improved population health, we recommend that you focus on, at minimum, these 3 things. The first being including diverse and representative perspectives in decision-making. The second being using equitable and inclusive arrangements. And the third being ensuring the collaborative work produces observable benefits. So then in our second series, our second part of this series, Getting Real with the Experts, Community Stories of Aligning, this is where we heard from 4 different panelists, each ACH leaders who are on the ground doing this work, figuring out how to make that secret sauce, and they each shared what that looks like in their community when they are putting those ingredients together and navigating the challenges and rewards that come with that. And so in the chat, you'll see there are links to more information about both parts 1 and parts 2. If you didn't have the opportunity to participate in those, you can go and see those slides or watch the recordings. Highly recommend. But that brings us to today, part 3, where we are digging deep into the data. And so where this third part comes from is that we have produced reports and presentations and have a measurement toolbox and data sets and all of this information that is available and ready for you all to dig into. And so what we wanted to make sure to do is to ensure that all of the resources that we've produced over the last few years are publicly available and readily accessible for anyone who wants to use them. And instead of having them kind of spread out as they've been over the last few years, we've put them all into one place. And so that's what we'll be digging into today, is the Aligning Systems for Health Data Walk. And now this data walk is pretty comprehensive, and it's also not all about quantitative data. So I know a lot of times when people think of data, they think numbers and statistics, and you'll see some of that in this data walk, but it is really a repository of information. And so what we'll do next is spend a few minutes going through this data walk together. I'll show you some of the key pieces and explain the different parts. But really where we're going to spend most of our time together today is providing an opportunity for you all to dig around the data walk, to go on this data walk. You'll have the opportunity to either do that individually or in groups. We'll come back to what these breakout groups will look like in a moment. But next, I'm going to hop into sharing this data walk and showing you around some of the features of this data walk, so that when you hop in, you know what you're doing and where to go. So let's see, I believe in the chat in a moment, if not already, the data walk will be put in there. I'm seeking to grab the right. Here we go. Okay, so when you open up the data walk on your screen, it will look something like this. And so this data walk is really the most comprehensive repository of our lessons learned from the Accountable Communities of or for Health research to learn how multi-sector collaboration leads to increased alignment, advances equity, and can be sustained. This resource is for anyone who's seeking stories, statistics, quotes, examples, definitions, ideas, or references to other sources focused on multi-sector collaboration for improved population health. And we've really set this up to be a choose your own adventure type of data walk. So if there are specific things that you're interested in, we hope we've set this up in a way that you're able to find what you're looking for, but you can also just kind of poke through this journey as whatever way is most interesting to you and draws your attention. So you'll see over here on the right-hand side, a little MSc journey where we kind of walk you through what is this concept of multi-sector collaboration. And we go from what is multi-sector collaboration all the way to what practices support aligning sectors for health. And so maybe the right place for you to start is here with what is multi-sector collaboration. So you can click on that link and you'll be taken to a page that provides a pretty high-level, concise overview of the answer to this question. But you'll also know at the bottom of this page and at the bottom of every single page on the data walk, you'll see links where you can go to learn more. And so here, if you want to learn more about multi-sector collaboration, you could click on this link and it will take you to the first part of our 6-part brief series that is focused specifically on improving population health through multi-sector collaboration. And here you can scroll through this brief to learn more about the ideas related to multi-sector collaboration. Now, let's say that you know multi-sector collaboration, you're in maybe a multi-sector collaborative, you're an expert in all of this, and you want to hop straight to maybe how can multi-sector collaboration improve population health? Again, you can pop here, see kind of the high-level overview, and then link out to related resources. Once you hop through wherever you want, if you want to get back to pieces of the data walk, so we just looked through this MSc journey, some pieces there, but there's so much else in this data walk to check out. I'd like to point your attention to this project background space. We didn't spend too much time talking about the aligning systems for health research at the start of this, but if you're interested in learning more about the research, you can click here. If you're interested in learning more about Phil, click here. Sometimes we get questions about research methodology. So if you're just really interested in digging into the methods, what were our research questions? What's our research design? What did our data collection and analysis look like? You can check that all out. It's all here for you. Now, the next thing that I want to show is just a brief overview of these key concepts. And so I started off by mentioning the Accountable Community of or for Health model, or ACHs, and didn't say much about that. So if you're interested in learning more about ACHs, you can click here on this key concept. And again, you see that we provide some concise high-level information and then include a bunch of resources down here. And so, at the top here, we have a brief that is specifically about ACHs and how ACHs can transform health systems through dedicated multi-sector collaboration. I do want to note that of these concepts, some are more conceptual like this, where it's more focused on ideas, but there are other pieces of the data walk that are more empirical, meaning that we pull in some things that we observed from the research. And so, for example, if you go to equity, this is one that brings in some more of the research findings. And this is where you'll see some quotes from research participants, so bringing in qualitative data. This is where you'll see some statistics from the surveys that we filled in. And also these last ones, perceptions and influence, these are summarizing some of the more advanced inferential statistics that we've conducted throughout this research. And so you get a little bit more depth on some of these empirical ones. And again, your related resources down at the bottom here. So let's say that you are really just interested in all of those resources that are listed at the bottom of each of the data walk pages. You can go over to the resources section of the data walk And you'll see that we have the resources grouped by reports and briefs, tools and guides, presentations and discussions. If you're interested in requesting data, we tell you how to do that. And then also information about other Phil services. And so this is the place for you if you really just want to dig into those other resources. So that is just a high-level overview of the data walk. What we're going to do next is spend some time digging into this data walk ourselves. So you're welcome. I know there are a lot of different types of learners out there. So you are welcome to either stay in this main room and walk through the data walk on your own. Feel free to turn your camera off, do whatever makes you feel comfortable. We'll play some music in this main room. But if you are the type of learner who really wants to learn alongside your peers, we'll open up some breakout rooms. We have 5 topic-specific breakout rooms. You'll notice that there are corresponding pages in the data walk for each of these topics: community engagement, power dynamics, equity, systems change, and sustainability. And so if you really want to dig into one of those specific pieces of the data walk with your peers, feel free to go into one of those breakout rooms. We also have a hallway where if you have another topic that you're interested in discussing with folks, or you just want the chance to bump into people and don't necessarily have a topic in mind, the hallway might be the right place for you. So these breakout rooms will open in just a moment. But I want to pause, and so after breakout rooms, so we'll have about 10 minutes for this. Then we'll come back together. If you had questions from going through the data walk, if there's anything that you'd like to discuss with the group, the rest of the time will be focused on just any questions or discussion that have surfaced from your data walk journey. Before we open up breakout rooms, are there any questions about what we're doing? Anything that's unclear?
And Stephanie, if I could chime in, at the beginning, we had a slide and I just posed to people to put into the chat, you know, what drew you here? Are you looking for something in particular? I see in the chat, we have a couple of people who, I see Shelley, welcome Shelley, nice to have you here working on ACEs. Someone else is working on their CHA and their CHIP and want to know more about how to collect data in a collaborative manner. And Jasmine is, data is my strength. So she always wants to learn more, which is awesome. Anybody else want to share anything that you're really looking for? You're on a search. I know sometimes I go down vortexes is what I call them. I start trying to find things. So we just love to hear from anybody who'd like to share, you know, what drew you here and what are you seeking? Jasmine, do you want to share anything more about your data and what you're anything you're looking for in particular?
Sure. I mean, there's nothing in particular that I'm looking for. We're new coming into building an ACH. So it's just looking at the way that this has been applied by others is really helpful for us, but also to see how this fits with the work that we've been doing. As I mentioned, we have data as a strength for us because we have like child death review team data. We have strong partnerships with our child welfare department, so we have child welfare data. But again, it's very quantitative versus that qualitative perspective. And so again, seeing how others have used that qualitative perspective is really helpful for us.
Great. Thank you so much for sharing.
Absolutely.
Yeah. Anyone else want to share before we go on our data dive? And Sue, welcome, Sue Kincaid. It's nice to see you. How to measure impact of health equity work. Look at that beautiful face. It's nice to see you. Anything you want to share on that, Sue? Or
you know, we hear a lot about health equity, and you know, we've been doing our work, and we need to show that, you know, measurable impact and communicate that. And there's just so much going on in Fresno County that it's all swirling around me. And so we're trying to do some strategic planning and focus. And I want to bring to the group, you know, here's what we need to focus on as we implement our work.
Great. Well, welcome.
Thank you.
So I see a couple more in here. Stephanie, I don't know if you're seeing like how to build multi-sector collaboratives that authentically engage and center communities. And then learning how it's been done in other places. There's a lot here, Juan, right, for you to dive into, particularly around community campus partnerships. Very fun. I love that. Power dynamics and systems change. So a lot of great comments here. Okay, Stephanie.
All right. So I think that at this point, we open up breakout rooms, we come back, we discuss these great suggestions in the chat, and we have a full and rich discussion at that point, unless, Sue, are you thinking that you want me to address these in the chat right now?
I'm wondering on one or two of them, maybe around the equity and or I'm seeing like power dynamics. I know that's a big one. Any tips of where to actually go to that could be of help might be really great.
Sure. So let's focus on, let's see, let's start here with power dynamics, which is the last one I heard. And so we do have that as a key concept here in the data walk. And so here you can find power dynamics. You can learn a little bit about what we have kind of synthesized across research with our key takeaways, some related quotes. But what you might be interested in, if you're really wanting to dig into this more, is we have one of the kind of sub-studies that we did for this work was specifically on power dynamics, adapting to local context and confronting power dynamics. And so you might be really interested in checking out this report down here. We also did a web discussion where we heard from a panel of ACH leaders on this topic. And so this is a great area to look at. I also saw, let's see, there are some questions about measurement and like measuring health equity. In this case, I want to point your attention to resources, the tools and guides. And so specifically, there's actually one that related to another comment I saw in the chat too. So this is where I'd like to point your attention to two measurement toolboxes. First, we have this toolbox for measuring cross-sector alignment. And this is a toolbox that was developed by Phil. And in this toolbox, we have project background, measurement overview. So let's see, an overview of all of the measures that we collected. But what you might be really interested in for those who are seeking to figure out how to measure this stuff is we've made all of our data collection instruments that we developed, these proprietary data collection instruments where we have not only gathered measures used from other places. So we started off by doing a thorough review of what's out there, what's already being done. And so, for example, the CACHI evaluators have used a survey over multiple years. And so we partnered with CACHI to adapt or adopt some of those measures. Similarly, in Washington State, there have been several external ACH evaluators, and we worked with them to adopt or adapt some of the survey measures there. But I suppose interview guides as well. But so here you can see we have the survey instrument, meeting observation guides, interview guides, focus group guides, document measures. I think oftentimes documents are overlooked as a great data source, and you can structure, or you can, collect document data in a structured way and even plug it into advanced quantitative analysis. And so this is the first place I'd point your attention to if you're really interested in measurement and figuring out measurement for yourself, the place that might be helpful. So if you look at this full measure and source overview, this is helpful because we have all of our measures grouped. Oh, that's not actually the one I was looking for. We have all of our measures grouped by kind of domain. And so if you're interested in looking at specifically, how would I measure trust? You go to this document and look for the things related to trust, this concept of trust or success factors. We have several related to racial equity, others related to health equity, some related to power dynamics. And so this might be the place for you to start. But I also want to point your attention to, because there are other great measurement resources here. So for example, let's see, this team, a toolkit for everyone aligning and measuring. This was created by the Georgia Health Policy Center. And what they did, so Phil is one of 7 national aligning systems for health research grantees. And also there are multiple rapid cycle grantees. We were also one of those. But what Georgia Health Policy Center did is they collected measures across all of their different grantees, Phil just being one of those. And they created this huge measurement toolkit where they have recommended a base set of measures for aligning. This GRASP tool is kind of, let's see, it is the consensus on the status for aligning efforts, but they also have this compendium of measures where if you want to go and see all of the different measures, this might be where you go. And again, they have it broken down by kind of topic. So if you're really interested in measuring health equity, really interested in measuring power dynamics or collaboration levels, this is another place you can go. Okay. I want to make sure that we protect time for people to dig into this themselves. Is there, I haven't been tracking the chat. Is there anything else urgent that I should address before we give time back to folks?
No, I think, Stephanie, we're good to open up breakout rooms. And I think for those who do have specific questions, you are welcome to stay here. We are going to have a session for question and discussion after you do your self-exploration. So again, this time is going to be here for you of 10 minutes to be able to explore the Data Walk website. You can either do that on your own, or we're going to open up those breakout rooms where you can jump into a topic specific room. Again, each of those topics is aligned with something on the Data Walk website. And so we're going to open up those rooms right now. You will be able to self-select into those rooms and move around as you desire, or just jump back out into this main room if you want to do your own reflecting. Welcome back, everybody. I hope you've had an opportunity to get a look at some of the information in the Data Walk. Again, we know that there's a lot of content in there, so thank you for spending just a little bit of intentional time digging in, whether that was a specific topic of interest to you all in a breakout room, or just kind of poking around at large to see what's available in there and the good stuff that we have. So we're going to open it up right now for some question and discussion. So first, I just want to start with any questions that people have as a result of their own exploration. So we're just going to start there. So if you have any questions or things that came up for you as you were exploring this Data Walk, things that you're like, maybe I didn't see this and I wanted to see this, or where is this information? You can go ahead and put that into the chat or unmute yourself and just go ahead and share your question out loud. Examples of data sharing agreements. Are there any examples? I know that maybe there are or are not in the Data Walk, but we always have other examples from in other places. So Stephanie.
Well, and I'm curious, Sue, does this speak to the ACH Startup Guide?
It's been a minute since I've looked at it, but I can look Juan to see, because we've been curating, kind of like a hoarder, scary, a variety of different examples of things. So I think can certainly look and make that available, Juan, and if others are interested.
Yeah, and just to be specific, we were talking about, part of systems change is being able to share that data. That's maybe one of the first steps, but even looking at different platforms, maybe where, we've always talked about, you have this whole person care perspective, but then every system looks at the individual from their lens. And if there are any platforms out there that where K through 12 education, social services, healthcare can all have like a shared agreement to look at the person from a more holistic perspective.
Juan, I'm gonna I see Stephanie Hartsfield here, who doesn't have her camera on, who's there now, she's showing up, who's kind of a data guru in this space that may have something to offer. Stephanie?
Yes. Oh, my camera's showing up, but I'm not there. Hi. Yeah. I missed the beginning part of that because I stepped out, but it's around the data sharing agreements and what's there. Is that what the question is?
Yes, and if there are platforms where different sectors can look at an individual from the different perspectives, like education, healthcare, social services.
Yeah, there definitely are. And I think what it really comes down to is there can be role-based permissioning, and it really comes down to how you are set up as a multi-sector collaborative on your data sharing agreement. And that's the ideal situation, really. And the platforms can absolutely do this based on how you've set up your data sharing agreement. And I don't want to say ideal ways to do it. There's different ways to do it. Sometimes I think what we're most commonly used to seeing is where there's kind of a release of information or data use sharing agreement, and people can check individual boxes for which organizations they want and don't want. I see Dr. Lee has her hand up too, but what's becoming more common is that if you're all folks in a collaborative, you really are saying to participants that as you talk to them, that you're okay with folks sharing information with people participating in the collaborative on a, minimum use necessary situation. And then there can be the role-based permissioning within the platform so that you're only seeing clients that you need to see, but it is done in a secure manner, following HIPAA, and they're able to do it. And that's the best way really to do this integrated care coordination so that we're not duplicating and you're talking to each other. And you do have to abide by the 42 CFR and the FERPA and getting all of those addressed, but it can be done. You just have to be really specific and careful. I want to let Dr. Lee come in as well.
Hi, I'm on the same kind of exploration with JC, just because a lot of the time, and I'm just so excited for this, because for me, like I'm just gonna dive in and I'm just gonna get lost into it. But I think a lot of the times when we're working with a collaborative, we're working with different definitions and different sectors who comes in with the different definitions. So one of the things I'm actually really interested in knowing is that, I love this data crosswalk resource, but is there a data language that could kind of translate into what are we talking about? Like standardized, what is it that we're talking about in terms of the population health? At the same time, we all know that it's important to have the a counsel, like the lawyers in the room, to really talking about data sharing, but also, just to cover all the FERPA, all that requirements and HIPAA requirements. But at the same time, is there just a common language that we could just kind of put in an MOU that, yes, maybe some folks doesn't have the legal team on board, but also could agreed upon kind of the basics, data sharing standards? Does that make sense?
Yeah, and I don't want to be the only one here, but I will say, so I've worked in both national and state integrated care models for this. And the answer is yes. Is it easy? No, it can be done. And I've sat in rooms where you bring in the privacy officers, the chief technology officers, whomever it is from several sectors. And if you put them all in a room together, which is in some ways the best thing to do, instead of having everyone go back and ask their information officers, put them in a room together and they will never agree on how to interpret HIPAA law. They just don't. And we should all acknowledge that, right? However, there is a bare minimum. And so we can say, let's come together. And there are now models for this, and especially with some of the new ONC rules, because nationally, ONC is realizing this is what we need to do for the best care models possible. So there are now templates, there are models with the FHIR regulations. We can do this, and there is a way. And this common glossary, yes and no. I mean, not everyone speaks data language. I'll put the link in the, I'll share a template. I will put a link in the chat too, because I know there's a lot of people from California here that right now, DHCS is looking for feedback on the data use, the data sharing guidance. And I think all of you should jump in and just look at it, because we want to get something that we all like, that feels like it speaks all of our languages. So I'll put that in the chat and then I'll pass it back over. But the answer is yes. And it'll take us a while to get there, but it can be done.
Awesome. Thank you all so much for such a rich dialogue, and Stephanie in advance for sharing those things in the chat. Dr. Lee, thank you for interjecting, and JC as well. Really appreciate that. So I'm glad there's some connections happening and resources being populated. Stephanie, I know you had a chance to comment on Laura's question about measuring systems change. If you could just spend a second sharing a little bit about your thoughts on that, that would be great.
I would love to. And before I do that, I would also like to share the Powering Change curriculum, because I think there's a lot of stuff in here that is related to the last topic and a lot of these questions. So I'll get to systems change in just a second, but how are we doing on time? Okay, so this is the Powering Change curriculum. There are some questions about, how can you actually do this work? How can you engage community in an authentic and genuine way? And I would highly encourage you to check this out, the Powering Change curriculum. This is a free curriculum for multi-sector collaboratives. You can get to it through the data walk, but it includes several, let's see how many, 11 modules on topics that are of central importance to multi-sector collaboration. One of those being measuring change, data collection, application, and sharing. And so I was just looking through this to see, like, okay, do we have example data sharing agreements in here? Because I didn't remember. But you may want to check this out and look through. Not only do we have concepts outlined in here, but we also link to other resources that aren't directly linked in the data walk. And so if I know that there was something about community health needs assessments, and so there's information about that in here. There's information about data sharing, data sources, all sorts of stuff. And so if you haven't yet checked out the Powering Change curriculum, please do. There are just so many other resources related here. And I still haven't seen if there is a link to a specific data sharing agreement. I feel like I've seen one somewhere, but I'll stop obsessing over that and address Laura's question. So Laura, that is a fantastic question about measuring systems change. This is one of my favorite things to think about and try to do. I say try because I've done it successfully a couple of times, but to varying degrees, and there's always room for improvement. And so I noted that those two kind of measurement the measurement toolbox and the measurement toolkit, both of those have both qualitative and quantitative ways that you can assess systems change. And so, those are more kind of direct reports from people on their perceptions of systems change. But there are other ways to do it in a more kind of observed manner. And so less about direct report, more about looking at the world and seeing how the system has changed. And one of those that I found to be really useful is network analysis. And so a lot of times network analysis use data that are collected from direct report. So people saying, hey, I did this with that organization. I referred data here, or I referred here, I shared data there. And so that tells you about a system from people's perspective. But there are other ways to gather network data that are super objective. I mean, if you have access to referral data, that's all network data. If you have access to agreements or meeting agendas, meeting minutes, that's all network data, where you can actually track how a network and and also you have to define your system. Like what does your system mean? Are you looking at a referral system? Are you looking at a data exchange system? Are you looking at a collaboration system? And so that's the first important thing, is to look at or to really understand what is your system and to define that. And then from there to look at all the different types of data that you can use to see how that system has changed. So the two examples that I put in the chat, one is using network analysis to measure systems change over time. And this example is with an ACH and Washington State Better Health Together. And then the second one is showing how systems change can be assessed using a mixed methods approach of process tracing And in this example, structural equation modeling is the quantitative method that's paired with process tracing. But it doesn't have to be that complex. It can be more survey data or even like interview reports. I'm hearing how it's done, but this process tracing pulls on document data, pulls on interview data, pulls on observations. And so these are just a few examples of how that can be done. Laura, do you have any questions? I want to also, John's had his hand raised for a while, but Laura, does that answer your question? Do you have any other ideas there?
No, that was great. Thanks. I appreciate that.
Okay, I'm also interested in asking just real quick, do you know of other ways that I didn't mention? Because I know that you're also an expert in this area.
Well, yes, I think it goes to the definitional discussions that have to happen for, what is a systems change, what seems to be leading up to a systems change, and then trying to measure what's leading up to the systems change, as well as whatever you've defined as kind of your goal for a systems change. And, the more we can see that in the literature and have something to lean on, the better off we all are. So thanks for offering those resources.
Yeah, my pleasure.
Yes, and we did have one last hand raised. John, I know your hand was raised a minute ago. Okay, there you are. John, do you want to share anything or ask a question?
Yes, thank you very much. I happen to be over here in Philadelphia, so I thought I'd jump in. In relation to HIPAA, my understanding is that one way to do it is to look at, I keep receiving examples and cases where people have been prosecuted about HIPAA breaches, and as it were, that's working up from the minimum. And that might also give some guidance. I accept what you mean about, you ask lawyers and everyone has a different interpretation, and HIPAA is, it's not specific. In terms of measuring systems change, the general approach that I've attempted to use is, well, what's the scope of the system, the boundaries that you're looking at? What level are you looking at the change? And then it relates to, will it make it, who will it make a difference to your measurement? What difference will it make to whom? And so the whom question in terms of stakeholders is critical. It relates to the levels. And then about what specifically do they want to know that might make a difference if you track measures over time, or do a comparative measure, or measure to standard. And then list your choices about, are there measures already existing that we might be able to use or adapt to our purposes for this particular group. And then my default option is always, okay, let's ask people's opinions to rate 0 to 5 and take a sample of people, cross-section sample, that would give better informed information to the decision makers from, it couldn't even be just 10 people cross-section, and do a custom one if there's not already tool. So that's the kind of a generic set of things maybe to work through that I tend to use.
Thank you so much, John. I really appreciate that feedback and contribution. We are going to close it out here. So Sue, feel free to take over real quick for some closing notes.
Great, thank you. Seems like data is in a variety of different ways is really of interest, and I'm very glad that we were all here together. And so we are excited to be launching a multi-sector collaborative innovation network. I think in the work that we have done, we recognize that doing this work is hard. It can be very isolating, and it can be also very, very rewarding. And just that we have heard the value, right, and the importance of creating spaces to bring people together in learning and in resource sharing and collective advocacy. So we are launching, it's a bit of a pilot. you know, this innovation network, and it's really built on the concept of something known as third places. And third places, right? Like you have a first place, which is your home. A second place might be work. Hopefully your first place isn't work. Maybe that isn't your second place, but third places really are places where people can come together, right? In learning and just fellowship and just coming together. So our first kind of event is pretty low key. We're calling it Fill Up Your Cup, a third place for multi-sector collaboratives. It will be held on July 13th of this year from 2 to 2:30. And I think we are putting in the chat the link to how you can register for this. And just really, it is a very cute pun, isn't it? I know we love puns. We do a lot of with Phil on here. And I think this QR code, if you would like to use that, allows you to take the survey. We just would love to really hear from you how this was for you today, and if you have any questions or anything else, and that's really, really important to us. So I think with that, did I miss anything? Christina, did I miss anything?
No, I think that's it.
Okay, great. Yeah, we do really value your feedback, and we also are really curious, like for those of you that are just starting in this work, or maybe the work is changing, like what are the kinds of conversations that you want to be in? So that's really helpful for us, so we can help to cater those. So thank you all for joining.
Yes.